Hello, Dr. Papaspyridakos. Welcome to the International Dentist Podcast.
Thank you for the invitation, and I'm really excited to be here and share some of the experiences that I had.
I'm really excited to hear those. Many of those I heard before, but some I want to get them today, hopefully.
Some of them you will really enjoy.
Yeah, I'm sure I will. I'm really curious, what made you come to the United States to develop your dental career? Why here?
So it all started as I was thinking about it in 1996. In 1996, my father was visiting New York City with my mom and to attend the American Heart Association meeting, and they took me with them. And I was so impressed with New York City back then when I was a teenager, with the skyscrapers, the life, the busy environment there. And I told him, Dad, I want to come and live here. That's how it started. Of course, my father had studied originally in the States for his residency, so I was exposed to that.
He's a dentist or?
A cardiologist, an MD. And then when I went eventually to dental school, because that's what I liked, the faculty at the university were most of them US trained, especially the prosthodontists. And then I got a second exposure that if you want to do a prosthodontic residency, it would be ideal if you can go to the States due to the curriculum and the organized programs. So I said, okay, you know what? I love New York City and I have to go to the States to the residency. So let me apply and see what happens.
Did you even consider to apply in Greece, or you just decided from the end that you will just go to the US?
From the get-go to the US, and also a very close friend of mine had applied to New York periodontal programs 1 year before me, because I was in the army the year before. So he applied 1 year earlier and he got into. So my friend getting accepted to the perio program and me having the desire to and the push from the Prosthodontic faculty at the University of Athens to pursue the residency, I said, you know what, I'm going to apply. And I only applied in the New York, which was not good looking back. I should have been more diverse because I limited my options, but I had only applied to the New York, greater New York area.
Okay. I guess you were very convinced that you want to come to New York.
So impressed as a kid. This had stuck with me. Sometimes it gets inside you, and that's what I wanted. That's why I applied to University of Rochester, Columbia, University of Buffalo, and New Jersey.
And how was that interview process when you got I guess you decided already, you had so clear that it was New York, so you basically didn't really look into many other options, although you mentioned that it's good to have more options maybe. Was it your first time applying that year you got in?
The first time applying, and right after I had finished my 1 year mandatory military training, which is like a GPR, because when you become a military dentist, besides some basic training, you serve as you are a GPR resident. In reality, you treat the employees of the military camp.
Okay.
So right after I finished, I applied in the summer of 2005, and I got interviews from University of Rochester and Columbia. And a little bit later from New Jersey, but I was already in the States when I got it. So my first interview, I come to the States, I come to New York City, and then I had to drive to Rochester, so I can have the interview there. What an experience.
So you never basically, did you ever came back after you were young in the 90s? Did you ever came back to New York? Or it was like basically you were young, came once, and then for application?
Came once, and then I came again 2 years later in 1998, but it was not in New York City. It was just a tourist, some United States.
Okay.
Some states in the United States.
So you basically had no experience. Now you rent a car, go to your interview, drive in the middle of nowhere.
Nowhere. I arrived at Rochester, and it was evening already. I had to stay close to the dental school, which was across from the graveyard.
Nice.
Very for in Europe, we don't have this situation. The graveyards the cemeteries are outside the city.
Of course. First cultural shock right there.
And then the morning, having to be interviewed by so many different faculty was a new experience.
How was that interview process? You remember?
I still remember. I was very young and motivated and excited, so I wanted to having the opportunity to show that I want to come here and do the residency. So I was very, I think I looked motivated. They liked it, but it was a small program, and with plenty of faculty. So I got my interview, and after I finished in the morning, then we drove back at night. And then I arrived back to New York City, and the next day I was having the interview at Columbia.
Nice. How did that go?
I still remember when we drove back from Rochester, which was more of a suburban city. And then we came back to New York City. It was a big change. I knew, oh my God, I want to be here. And that reflected on the way I was having the interview. And that's the tip that I want to give to the aspiring dentists that want to come and do the residency. You have to be motivated, because that's a big step to leave your country and come so far away to do a specialty. And at least look like you're motivated, which I think everybody is motivated, but you have to be very motivated, because when you actually compete with the US trained dentists, it's very hard to have these GPA averages that they have and all this experience and curriculum vitae that they have. So my main
maybe tip
is that you have to be very motivated. I'm sure you are when you take the decision to apply, but you have to show during your interview how motivated you are, that you're willing to put down the effort and the time to take it to the next level, and you become the best version of prosthodontist that you can be.
Well, do you think that personality of yours and that motivation you show was what it made you difference, or what it made a difference for you applying?
Absolutely. I'm going to tell you. I had my dental school degree from Greece. I don't even know what it meant to them in terms of my grades, because we have a different grade system. It grades from 1 to 10. I had decent grades, but definitely it's not a 4.0 or a 3.8 or 3.9 out of 4.0 that they have here. It was much different, because the grading system is much more strict in Greece, at least. And what made the difference was the motivation. I have the interview with the chairman of the department, and one of the first things I told him, thank you for the invitation that you invited me here. You have to accept me. I will be the best resident you ever had. Dr. White. Even on my graduation day, he used to say, oh my God, I had never seen somebody that came into the interview, and the first thing they told me, you have to accept me. I will be the best resident you ever had.
I'm sure you will be remembered forever for that.
It was very bold, but when you are young and naive and super motivated, it shows, and you don't have fear or lack of the unknown, as they say.
Yeah. And do you practice that? How did you came up with saying that, or you were just so confident that that was a place for you to be?
I didn't. I was just so impressed when I went inside the facilities and I saw residents working, and I knew that was what I wanted to do. I was just inspired, and it just happened to come out of me. And I think it really made an impact, because he was impressed, I could see. Because, like I said, looking at my dental school transcripts from far Europe, and I'm sure he was getting a lot of applications, that made the difference, to show that I was really motivated and I was willing to put time and work and eventually be accepted.
Well, you know what you mentioned, I think is very important, because a lot of places in Latin America is the same. Our grading system doesn't help when it translates into GPA. It really doesn't reflect your standing. Your academic standing cannot compete many times from those numbers, from those stats with an American candidate. So anything that we can do to show the strengths we have, which many times, as you said, is just like personal strengths. Either your personality, that you're a hard worker, or you are like a problem solver or resourceful, like so many things that we can bring to the table, that is important to show that, right? That's the good thing about the interview.
Absolutely. Absolutely. It's not only a one trick pony. You have to be multidimensional, and definitely for us, the international dentists, that the dental school transcript system does not help show your academic quality. There are other traits, and one of them is the personality. You have to look motivated and be motivated, and this reflects.
Absolutely.
See that? That's
I
what
agree.
worked for me. And eventually, they even told me after I got a pet that no, we were really impressed that we were so motivated. And what I did was, but after I finished with the whole interview experience and with the residents and the faculty, I asked, can I come next day so I can just attend and watch? I think that sealed the deal. They saw that the young kid was very motivated and willing to come and spend another day in the clinic just to see operations. So I think that sealed the deal. But they wanted to come another day, not on an interview, just to observe and see what's going on.
That's very nice. Which a lot of people actually try if finances allow, but of course it's costly just going to the place and observe the place before and shadow and just go on to check. Like if finances are restricted, you basically maximize. You had 2 interviews in one trip. And if you were in New York, why not show up? And then maybe that was, as you said, what sealed the deal and what made a whole difference, right?
Yeah. A type of internship to visit before always helps. If it doesn't work financially, you can always request that you come and watch operations on a different day, if possible. Everybody will appreciate it.
Absolutely.
Shows that you really want to be there.
When you first came, then you knew for sure you wanted to be a prosthodontist because you had that in mind from the beginning. But you knew you wanted to stay, or that happened after?
That happened after. The original idea was like most of the international dentists, they are coming here to get higher education. The residency get the benefit of the structured curriculum that we have here, and then go back. For some, though, this changes in the way. And this was the same to me because I got to like it. And also, during my third year, I saw that dentistry is changing because I did my residency from 2006 to 2009. And that was a very volatile period and a time that things were changing rapidly. So
You're referring to things changing politically, economically, or in dentistry?
in dentistry, besides politically, because actually the moment I started my third year, the Lehman Brothers financial crisis happened. A huge crash. And New York City was one of the most affected ones by that. So I could see that in the types of treatment plans that were being done and the type of treatment. Immediately, it was a lot of work was arrested and treatment plans changed. But I'm also referring to dentistry with the technology started to evolve rapidly, and that reflected also to dentistry and also in relation to implant dentistry. So I found out, or I saw that I need further training. I need to know how to deal with dental implants further. And when I entered my third year, I said, I'm going to apply for an implant fellowship. So I'm not going back. I want to further my training with an implant fellowship. And I applied for the ITI scholarship program that had some US centers available to receive fellows or scholars, as we call them. So originally the plan was to go back, but then I said, let me further my training and apply for the fellowship. How did I apply for the fellowship? It was something that now is quite common. A lot of current international dentists that have been accepted to residency programs for prosthodontics, they do it after. Now it's a common thing to pursue. Back then it was not as much. And it was very competitive because there were not many programs. And it was a paid fellowship. So then, again, I had to employ my personality.
A paid fellowship, you mean you receive a stipend? So you got paid for doing it?
Paid for that.
Which is very unique for programs in dentistry.
Very unique. And I had, again, because I was competing with maybe people that were maybe a better curriculum, better CVs than us, I had to again employ my personality. So at the Greater New York Academy of Prosthodontics meeting at the third year of my residency in 2008, the meeting was 10 days before the application deadline for the program. So I talked to my faculty. I wanted to apply to a center near New York, and the only available was Boston. Back then it was at Harvard with Dr. Weber, which I only knew of him, but I never knew the person. So I asked my faculty, I think, it's a great opportunity in the Great New York meeting that you introduced me to Dr. Weber, and maybe that will help with my application. And that indeed happened. We arrived at the crater at the big foyer of the meeting, and immediately I grabbed Dr. Golden, one of my faculty, that is late now. And I told him, can you please take me to Dr. Weber? I want to meet you. I still remember that walking, he told me, of course, Panos, come with me. I still remember that walking among so many people in such a busy venue, I would see some residents that I knew of, and people were talking to me. I would only see mouths open. I was so focused, trying to go and speak.
You were going to the objective.
I was going straight to the jugular, as we call it. Straight right to the jugular, to the jugular vein. So he introduces me, and immediately, I say, oh, it's a pleasure. I want to talk to you about the fellowship. I'm so interested, and I will be the best fellow you ever had.
I mean, if it works once, you can do it twice, right?
Exactly. And guess what? It worked.
It worked twice.
It worked twice because people are surprised or stunned, or if they see the real motivation, not always polite and respectful, but something that you really have a fire of pursuing something and you can really put down the time and the work ethic, it worked. And then I got accepted.
Nice. And then you moved to Boston.
When I moved to Boston, which was a big difference from New York, it was a big difference.
I'm curious, what was that cultural shock first from Greece to New York? What were the big differences, or was that first thing you acknowledge, oh, this is a completely different place, and then from New York to here?
Yeah, that was the thing that really struck me was the people. It's always the people, how different it was. The skyscrapers, you get used to it soon. Or the living, it was the people. It was very different society.
How so? How different?
And not having your own comfort zone with the family and friends. And back then, all I had was MSN and Skype. Nowadays, we have FaceTime, we have WhatsApp, Viber, Messenger, FaceTime. Like I said, it's different. Communication is easier. You can even see each other. Back then, it was so different. You could see each other on Skype, but it had to be on a weekend and after, making a lot of arrangements. So the people was the thing that was different. That was the hardest thing in the beginning. Get used to socializing and being with international crowd. It was so different. It was very different. And getting used to the life that you have to have a house, you have to be the boss of the household. It's you. You have to take care of yourself in a foreign country. So I would say, yeah, the living and the people was the thing in the beginning that really was different.
In that process of seeing those differences, what was the biggest challenge you encounter adapting here?
I would say, again, the people being able to accept other cultures. It took some time to, we are all the same, but yet different. So my classmates were Koreans and Indians. I had never seen Koreans and Indians before. And they were fantastic people, but I had to get to know them and see the differences, the way they do things. That was what was really not obstacle, but that was what the beginning was different for me. You really get used to it soon and you assimilate. Mm-hmm. And then I had to ask how I do this, how I do that in this new system, how I take care of the electricity, or where do I sign up for the social security number? These things.
I mean, luckily you have your friend that was doing perio, so at least you had a close person to go to, right?
Yes.
But you didn't have any family on the States, or nobody?
Not really. I had some good family friends that eventually become family. And that was a good shell that they could offer. But the real for everyday things, you had to ask your co-residents, which had the same issue.
Of course.
You remember, getting a social security in New York is so hard.
Why?
Yes, huge lines. The red tape is unbelievable.
So I actually heard a lot of things like that are more difficult in New York than in other states. Do you struggle with any other things other than getting a social security there? Like license or anything like that?
All these things. You have to submit all your paperwork, the immunization forms, the license forms, the transcript forms, all these that we need. So it takes time.
How long? Sorry to interrupt you. How long did you prepare in Greece before coming here?
It took at least 3 months trying to get all the immunization forms and all these forms that I had to bring to the health science center for administration, for international office or something. I don't remember how it was called. To get all this forms. So you need minimum 3 months, I would say, realistically, to get all your records from your country. A lot of the times they need to be translated and have them ready. So when you come here, you submit.
That's even before after applying. Once you're accepted, just to get ready so you can be inserted in the system, right?
Yes, yeah. You need to have like a 3 month little time to get all the necessary documents. It might take less, but it's better to be prepared. Especially if you are to do a prosthodontic residency, you need to plan ahead. So,
of course,
3 months is very reasonable for any international dentist, whether they are in Europe or South America or Asia.
Absolutely. I think that's a very good advice, and it's a good amount of time, reasonable amount of time to do. Of course, some countries are faster or some others are slower, but it's a safe time to have in between. So you came to New York, Boston, then you did your International Team of Implantology Fellowship, so ITI Fellowship in Boston. But at this point, you still don't have a license, right, to practice?
Yes, that's the big question mark for all international dentists. They get this advanced training in the States, and even though they are dentists, fully licensed to practice in their own country or many other countries as well, they cannot work in the States. Currently, we know that there are some states that you can practice if you take a clinical license exam. Not a lot, 3 or 4 or 5, but not in most of the states. And that's the big question mark, like I said, what happens after? What happens next? Especially if you want to stay here for some period of time. There are many situations that maybe the financial situation is not looming in your country, or political situation that you don't want to deal with, and you want to pursue staying for some time.
Which is what you did.
What I do. So for me, I really like it. And I said, I want to stay here, but I want to be limited in these 3, 4, 5 states. So I have to do the American D.D.S degree, which the good thing for our specialty is that they offer it through a faculty track. There are universities in different states that can offer it through a faculty track, which means the young, fresh graduate can go and teach as a clinical faculty, and through that teaching route, they can get the American D.D.S and subsequently the license, which is a great pathway. I did that, and I had to move all the way to Midwest, to Michigan.
Nice.
That was shock. As open-minded I was not open-minded for that. I was not ready for that. It was a big difference.
What was it so shocking about it?
Again, the people. When the people, I think I really associated with people. So it was very different from being an international city like Boston, that has so many different cultures and people from many different countries, South America, Europe. It's the blending and the assimilation is brilliant. It's unprecedented in Boston. so diverse and so intellectual and so nice. It was different. Whereas in Michigan, there were not as many foreigners, and you could see that there was a difference in the way that people lived and interacted with each other. And that it immediately struck me.
How long did you have to stay in Michigan for?
I had to stay for 2 years. The international accelerated D.D.S program, as they call it, lasts for 2 years. So it is definitely a fast and efficient way to get the license without having to spend many years. And it's a very well-structured program, but in just 2 years you get the D.D.S, but it is in a different state. That doesn't mean anything because everybody is different. And young people can definitely assimilate and embrace the change and adapt and make the most out of it. And that's what I did. But that was what really struck me and was shocking in the beginning. I would say maybe even throughout, but the people were so different.
And then during that process, what type of requirements you had? What was the program?
The program is something that I would really even recommend to international dentists that eventually will get into residency program and want to pursue the D.D.S, because it is a well-structured 2-year D.D.S program that mainly you teach. And all you have to do is clinical requirements. So to satisfy the American Dental Association requirements that the dental student has to do competencies, like an endodontic competency or a periodontal competency, all you need to do is one cleaning, one root canal, one pediatric dentistry treatment so that they can justify that you're getting the D.D.S. So it's really a very advantageous route for a dentist. It teaches 2 years. You're getting paid, by the way.
That's great.
It's great. Out of your salary, you give back a very big percentage to them. You give it back to justify that you are getting the D.D.S, so you have to pay tuition.
So can you say that again? So basically you're getting paid, but from the part that you get paid, you have to pay.
You have to pay, you're getting paid as a faculty, but in order to justify that they are giving an American D.D.S to a student, because at the same time you have two hats, the faculty hat and the student hat, you have to pay tuition. And that tuition, of course, you can pay that out of your salary.
Okay.
So a big percentage of your salary will go to the tuition. Still, what is left can be almost enough to get by. So either the family can supplement a little bit, or if you can work outside because you have 1 day free, as a prosthodontist, because it is one of the states that you use to work outside.
That's good.
Supplement, yeah.
So if you have but you have to have the license to practice on that state, like a clinical license.
Clinical license. So one has to take one of these clinical license exams, such as NERB or RED, and get a license. You can get a license on that state. I don't know if it's still the case in Michigan, but it used to be.
I think it still is. That's definitely changing all the time, but I believe Michigan still it's an option. So that's good. So you're 4 days a week in the school, and then you still have 1 day for practicing, or 2 if you work on Saturdays.
So definitely it's a program that the international dentist will not have to pay out of pocket, because I know how straining it is having to go through 3 years of tuition and expenses and living. The cost is constantly increasing. It never goes down. So that's a great way to get the license that will take you to the next level without having to break the bank. Besides Michigan, there are other programs as well, as I've heard. A lot of them are in the Midwest. And it just happens that usually the Midwest has the accelerated programs, that there are programs that in 2 or 3 years you can get the D.D.S. There are other faculty route programs, like in our university at Tufts, which is has a lot of merit and a great pathway, but it takes a little bit longer. So it is up to the applicant. It's up to the applicant if they want to pursue a longer route or a shorter route. Usually, shorter route involves being in a place other than the coast.
Which is where the big cities are. For those that don't know, in the coast, East Coast and West Coast is where most people try to focus their living.
Yes, exactly.
They're also more expensive cities, and you talked about this financial strains, which I think it's something that we all struggle when you came here. At least it was my experience. I remember the financial part being always a stress of mine or for my family that were supporting me. Did you had a lot of financial stresses?
Yeah, because my parents were so generous to support me, but money was not endless, like most of us international dentists. So I was very lucky that they were paying for my tuition fees and living expenses, but there was a budget. And being in New York City on a budget means that you are in New York City with a budget. So you have to be very careful, very frugal, very cautious, and appreciate that someone is being strained so that you can get your education. That, of course, makes you become the best version of yourself because you are really appreciating the sacrifices that somebody is doing, that somebody is the parents, and you put your most effort to get the most out of it. Not that you need to do that, but that's how the feeling is.
Yeah, you're maximizing for yourself, but you're feeling you're maximizing for them too.
Exactly. And there are also faculty that can be mentors. That's what we can talk about, the mentors, and that they are so important. There are faculty that can mentor you and even teach you things other than dentistry, like even financial aspects. And I was so lucky to have this type of faculty during my residency in New York City, people that had big practices in Midtown Manhattan.
Wow.
So fancy. And these people were advising me on financial aspects, how I will talk to patients, how I will deal with the financial aspects of dentistry, how will I maximize my cost and benefit ratio, how will I get the maximum out of the money that they pay.
That's great. And what you mentioned about mentors, we all have mentors for different things in life. How helpful or how impactful your mentors have been to you?
So important. I cannot stress how important the mentorship was to me and my career. I can have different people that have helped me more or less, but there was one that really was instrumental in me and really affected me and helped me. And I know you understand who that is. It's Dr. Weber. Really had a tremendous impact in my career and the way I see things and the way I react and the way that he introduced me to clinical research, also that other part of dentistry that I got involved, and inspired me and mentored me all the way. That's very important because a mentor will, without having to get something back, can give you. That's very important, and gives out of his own will, and it's so important to guide you because we all need guidance. Mm-hmm. It was so important to me. It's really, really helped me, and I'm really appreciative of it. We have maintained a very close relationship even to this day, even though he's not anymore in academia. And I can really highlight the importance of having a mentor.
And I think that through mentorship, relationships evolve into friendships too. Because at the end, it's just like a mentor with experience, like a friend with experience, right?
That's true. That's true. I really like it. And we were talking to each other earlier, and I think that's something that we made it up. So
yeah, go for it.
Once you have had the blessing of having a good mentor that really helped you, you yourself in turn should be a mentor, and you should be the mentor that you always wished that you had.
Absolutely.
Or try to be the mentor that you always wish that you have.
Absolutely. It's a good karma, like giving back either what you had or what you wish you had. Because I feel if we all do that more often, we will first live a better world, we'll have a better profession. People giving more without intentions or without really a second plan behind. A lot of people are fearful into engaging into mentorship relationship because they either feel they don't have anything to offer or because they feel this person is too important, too famous, they don't need me, or the other way around. A lot of people take advantage from people too.
Yes. So very important to interchange. It's energy, it's knowledge, it's emotions.
So basically, Dr. Weber, you met him at the Great New York Academy of Prosthodontics meeting. He eventually became your mentor. Now he's your friend. So that relationship has evolved. But what happened after that encounter? You got accepted at Harvard. You knew you wanted to stay in the US at that point?
Yeah, as I stayed and I was doing the residency, I felt like I really like it. Also, it happened that with the financial crisis of 2009 and 10, the financial situation in my country that I was supposed to go back was so my will to stay, coupled with the fact that the financial situation in Greece had evolved into a crisis, the big financial crisis that started in 2010, made me, before I finished the 2-year fellowship at Harvard, pursue the dental license route. And I got the D.D.S. And as you well know, in 2013, I came to Tufts to teach again through Dr. Weber. He told me I had a spot. Do you want to take it? I told him, draw the papers. I'm coming.
Did you have to say again that you were the best teacher that he could ever have? He knew already what you had to offer at that point.
I just told him, draw the papers. I'm coming.
Through him, I think you got involved to research a lot as well. So can you talk a little bit about how did that path of research in dentistry started for you?
Yeah. There, during the residency, there are 3 components. The didactic, which you learn about the fundamentals and the current status of the profession and the standing that we have. It is the clinical portion. You focus on actually doing the clinical treatments that involve direct patient care, and the clinical research component, which is an additional component because some programs are combined with Master of Science, and a lot of the students are pursuing a Master of Science degree, either because it is a requirement if they go back to the country, or because they want to have an additional degree. So out of these 3 components, clinical research was something that I was exposed indirectly through my parents because they are both professors at the university in their own field, no dentistry. So I was exposed to research and education and university environment. But really, Dr. Weber helped me and guided me to really get involved into a well-structured and high-end project. So that really changed my approach to dentistry and to patient care, because I had to, the clinical questions that I had, I was finding the why. Why does this happen? Why does this happen? Why is this? Why this treatment protocol? Why are we updating to this protocol? And these clinical questions, he helped me guide into clinical projects to find the why and improve. And they deliver patient care even better or faster or more efficient. It's very important to have somebody that has experience, that they can guide you and help you channel your energy and your motivation, but towards the correct route and structure it so it can make sense. Because getting an idea is happens to all of us, but in order to make this idea a reality, you need to go through different channels, and to commercialize or make it realistic, you need help.
Yes, you said, I think we all have definitely ideas, and the curiosity. Definitely, that's the first step. If you don't have a curiosity, if there is not something that you don't have questions about, from questions is where research comes. But the guidance of somebody who has experience and have done it before, many times in a very well conducted manner, will make a whole difference in the way how you're going to approach that thing.
Yes, exactly. He used to say 3 things: get an idea, get a good team and maybe some funding, and get going with it. So this was the process. Get a good idea, get the team going and get going with it.
I guess the idea you bring, the team, how do you surround yourself with a good team? How do you pick up your team?
That's the importance of the mentor and leader, that they create the foundation and the other faculty to help structure and join a team, because it has to be teamwork. No one can do it by themselves. It has to be a teamwork, like we are so happy to have now at Tufts, at the Pizza Prost. So it has to be a team. That team is always put together by the leader. So he was really a leader. He put together a good team. I have to also highlight that Dr. Galuzzi really also played an important role. It just happened to have these two very important mentors at the same time. It was right on the point. So the funds were there, the environment were there, the people were there, the structure was there, the motivation and the help and the excitement. So I was feeling that I was involved in projects and I was doing something really exciting that can really give an answer and change the way that I practice and maybe some other people can practice. And that really was giving energy to a young aspiring researcher.
Of course.
Very important.
Yeah, in a way, you get that energy fuel by feeling that what you're doing, it will have an impact potentially for yourself and for others.
Yes, exactly. There were things that I would see in the clinic, and then we were doing a clinical project on that. And then trying to find the answers and seeing some results and some explanations was unprecedented for me. I like it so much. And then habit becomes next nature.
And then by now, we know that you have developed that second nature for research and for clinical research, which is one of the biggest strengths. And a lot of people could agree in the field. And we're very proud to have you in our team. As you said, it's all teamwork.
It's teamwork, and we have a fantastic team. And now I think it's the time to evolve into our own team at Tufts and even expand. We have the facilities, we have the time. We got a little bit laid back, put back from the COVID crisis. But I think we will come back stronger than ever now.
Yeah, we will.
The team that we have and the facilities, coupled with the technology that we have and the people, again, the people is so important. People are so important. I think we are set for success and to expand even more. So important. The things that were there at Harvard when I was in my beginning and evolving, we have them for sure at Tufts. So we will definitely evolve and hopefully mentor and motivate the younger generation now, the residents and maybe junior faculty, to pursue clinical research, answers, and more answers.
Yeah.
More questions.
More questions and then eventually more answers. I think what you mentioned with mentorship also goes back to peer mentorship. Many times we think about a mentor as somebody that is maybe a lot older than us, but how often you have friends that maybe your age, they can mentor you in certain things, or you can mentor somebody that your same age or same level academically, just in a different things that they're not exposed to.
Absolutely. The residents may not see that, but so many times I will come to you and say, Gabi, Khaled, take this case I have in the practice. What do you think? It's so important. That is a form of mentorship. It's collaboration. It is collegiality. So important. Always learn. Always learn. There is a Greek saying that says, I age and I keep asking and learning. It's a very famous quote. And I always learn as I keep getting older. That's how it should be freely translated.
That's so true.
And so true.
So you talk a little bit about the COVID crisis, and I'm going to connect that with a question I'm curious about, because after you came to Boston, started teaching, eventually you went out to practice as well. So now you have a little bit of a different perspective. So what's your typical week? What do you do for others that don't know, other than publishing articles and being teaching in academia?
Now I share my time between teaching and in academia and practicing the dental clinic in the private practice. it's a good balance. Teaching is something that I love and I will never relinquish. It's so important to be able to give back and teach, and it makes you better too. It makes me better. I have the best colleagues I could ever dream. I collaborate with all of you, and with the residents, we also evolve and learn. And it's so precious and so fulfilling to give the information and then see the glow in their eyes when they get it, when they finally do a big case or they finally do something and they get it and I love it. I love it. I love it. And besides part-time teaching, I also practice 3 days in the private practice, which is good because you can put your clinical skill to the real world and put your clinical research and outcomes and protocols into efficient and expedited treatment in the private practice. Because the private practice is a different setting, and some people say different world. The requirements and the demands of the patients are different and higher because they are paying a higher fee for the treatment. And you again should offer the treatment that you would like to be offered. So that's always how I approach the patients, with empathy, both at the university as the residents know, but also in the dental clinic. But the beauty and the fact of the matter is that all this knowledge that we get in the university and these clinical research outcomes and these protocols that we implement with the massive amount of patients in the university are very important to be implemented also in the private practice. And that's where you see the fruits of your labor, because you can do dentistry efficiently, expedited, and also have a significant supplement to your income.
Yeah. Which is very important at the end, like after all the years of school.
Very important and necessary, I would say. The full-time academia is very fulfilling. Financially, it has a limitation because it still remains a salary, whereas in the private practice, there is no limitation because the more you would work, the more you would make. So for me, currently, I think I have the golden balance between both worlds. I get to do both. And like I said, teaching is good for my soul. Back, I learned constantly. I interact with friends, colleagues, with younger people, residents. They are always uplifting to talk and interact with them. But I also have the private practice, which can give you the pleasure of doing something yourself, meeting people, having the appreciation of people in the real world, and definitely significant financial gain.
Yeah, the financial freedom that I think you cannot get otherwise.
Not get otherwise. And it's necessary to have that at some point of your life, because we are all international dentists turned into specialists, turned into how can I say, life wanderers, and we have to go ahead and do more things.
Absolutely. Absolutely. So basically, looking back, it's been a journey of almost 15 years for you, right?
Exactly.
Since started.
15 years.
Wow.
Wow, time flies.
It goes by very fast.
I still think that I'm back in 2006 sometimes. Thanks for.
Nice.
I thank the residents for that.
The residents definitely help keeping us younger, more energized. And I don't know if that was the same to you, probably it does. It reminds me when I was a resident and all of the things that I felt and I experienced when I was there in that very moment.
Exactly the same words I will use. Energized, and it brings you back to where you were a resident.
Yeah.
And that's so precious. It's a unique thing that I also saw my mother as being a professor in the university, having this interaction constantly over through the years with young people. That keeps you young too.
Yeah. Well, the parents are the first mentors. They said that.
True. See, I talked about mentors, and I guess my parents were the first mentors, because their impact was indirect, but so direct at the same time.
Absolutely. If you could.
But fit in New York City, maybe I wouldn't want to apply to New York City.
Look at that. That was the first step. Imagine.
Yeah.
I remember when I met you, and of course you were just moved to Boston, and the first, I think, couple of sentences were like, "Yeah, I'm in Boston now, but I'm gonna settle in New York." Like, what?
But you just came.
Yeah, well, you were so convinced that New York was the place for you eventually. Is that still in your mind? I know it's in your heart.
Still in the heart, and still I have a full New York City license. I eventually got a license, which is a little bit tricky and hard to get. And that's the power of your brilliant work now with the podcast, that I think this will create a channel of international dentists having access to all of us to contact us and get a ton of information of how to apply, where to apply, how do I get a license, how do I get a limited license, how do I apply for a New York City license, a Boston license. And
What was it difficult from the New York license?
the New York license is the only license out of all the states in the United States that is so hard to get, because it requires college education as well. And the college education of Europe or South America is not recognized. You have to have maybe a second master's of science degree to cover the credits of that thing. For me, I was lucky because I used my Ph.D. towards the requirements of a college degree, which might sound a little bit strange how a Ph.D. becomes downgraded to a college, but that was the silver lining of the Ph.D. At least I could use it towards the credits of a college education. They require 2 years of college. They say for international dentists, you have to have 2 years of college additional credits to be able to be eligible for the New York City license, which you will get with the American D.D.S and the specialty degree, and after completing some other courses online.
Okay, so basically for somebody who doesn't have a PhD, they basically have to go back to college.
To college, or put a Master of Science towards the college degree. I have to say something for the international dentists. The Master of Science that they are doing simultaneously with their prosthodontic residency is not eligible to be applied. The rules are so strict that the Master of Science that you do during your residency, because it was simultaneous with the residency, is not valid. Because I also did the Master of Science and it was not valid.
Also, basically has to be a Master in Science separate from a specialty training.
On a different time. If 10 years, they automatically reject it, which is such a strict and odd rule, but this is the rule.
I'm glad we talk about this because that's so...
It is unprecedented and I would say not fair, but these are the rules and unfortunately you cannot bend them. Or for example, our residents that are doing Master of Science, they cannot apply this because it was during the residency years.
A lot of people do their masters combined with the program. Even if it's not combined itself as constructed combined, they do it in the same period of time.
Yes. Only the ones that will spend an extra 4th year can justify that they got a Master of Science and they can put the credits towards that. The credits that the New York State requires are 30. Hopefully a Master of Science done on a 4th year will give you the 30 credits. I'm not sure if they give the 30 credits, but hopefully they will.
I know a lot of people look for online degrees or something so they can collect the 30 credits they need when they need to get the New York license, but it's tricky.
It's tricky, and it's a lot of classes that you have to do, because most of the courses give you 3 to 5, so you need to get a total of maybe 6, 7 courses.
Wow.
It gets pricey, and it's a little bit odd, like I said, because you've done fellowships or Master of Sciences or all this, but then you do not apply. So that's why it's tricky. For me, it worked out, because I really wanted, as you very well know, I was obsessed of getting that New York City license. I have it. I think I'm settled now. It's Boston for the time being, but you never know. So
Boston tends to conquer hearts. So
yeah. It is a city that definitely you will like from the first time you come. And again, the people are what really help put a city or a place at heart. And it's such an international city. You meet so many people here, so good friends. We have evolved from resident to a faculty to so close friends. And I wouldn't change that for anything. It's fantastic. that our profession offers the pleasure of dealing with people, and as stressful as it is at times, it's the people that change the game and change you. You know, you get to meet so many talented and inspirational people, annoying patients as well. We all know that. But at the end of the day, you keep the good and you discard the bad.
Even with those, you learn. You learn even with the hard ones too.
As we say also in sports, you win or you learn.
Exactly. Exactly. I would like to ask you final advice. Looking back, if you could talk to that 20-year-old Panos, excited about New York, planning coming to the US, what piece of advice would you give to yourself?
Preparing for potential when you are a dental student, I guess.
Yes.
I don't think I would change anything from my journey, but what I would have done more in advance would be preparation. I wouldn't have limited myself only to one place. I would have tried to create the networking and the connections to meet people that are already in the States and connect with them, get information, get a channel of information, channel of advice, and this way make my coming to the States for an interview or investigation or observation period, or for the final interview and application, a little bit easier or more diverse. This is, like I said, so important what you're doing with this podcast, because I think definitely this will open the channels of communication and information to a lot of other people. I would say preparation and networking. That's what I have done more. The more the options, the more the chances of getting to your ultimate goal, which is a residency or a specialty in the United States, since we talk about that's what I would have done.
Absolutely. Expanding the network of mentors so you could explore your possibilities and know what's out there. And hopefully this space is going to create that. It's going to extend a constellation of mentors to others that not yet know anyone in this country and want to know what are the paths. I found probably you felt the same. And that was my main motivation creating this. I felt that, yes, there is a lot of information on the internet, but the internet doesn't talk to you. It's just a plain website, right?
Exactly. Now it's so easy to get this email and send it or find information online, but it's the people that will make the difference.
Yeah.
I'll guide you and will tell you the ins and outs and the tips and tricks. It's so important, and I think this will have an impact. I'm sure this will have an impact. There are so many international dentists out there that are considering doing the step, but they don't know how, or they don't know when, or they don't know why, or how to. This will create the channel for this.
I'm sure.
We're so happy to share information. It doesn't cost us anything. It can only expand the network for us, meeting people from other countries. So it's definitely a win-win.
Yeah. I want to make sure people know that we're here for them. We're here for every single person that is now in that position we were once, because the way how we've been helped, we are hoping to help back.
Exactly. After all, like we said, we aspire to be the mentors that we wanted to have when we were mentorees or younger.
Absolutely. If people want to connect with you, what is the best way? Is it email the best channel?
Email is the best channel. And nowadays, in the new age, we have also the social media. But I think email is a very direct and efficient way to initiate the contact. And then we can take it from there.
Okay.
That technology that we have, these platforms that we can even communicate anytime with FaceTime or all the applications.
Super. I'll make sure I'll leave your contact information on the description note. Well, thank you so much, Dr. Panos, for sharing your international dentist story with me. Any final thoughts you want to give?
I'm so excited for this. I told you from the first moment you told me how of a brilliant idea it is. I think it will have such an impact. Again, I'm sure it will have such an impact. I'm sure of it. It is a great way. We know today we only see cases in the social media, but a lot of this sometimes has no essence. The essence is spread information and collegiality and help people. And it's only a good thing. Help, you get help. This will definitely have an impact because it will open the doors for other people to come and experience this, what we have experienced.
Absolutely.
What a brilliant idea. I'm excited to see the edited outcome.
It will be really fun. I'm excited too. So I really hope that it makes a significant impact for others. And I really appreciate your support from the very beginning because you know how much I respect you professionally. I appreciate you as a person and I care about you as a friend. So you have been very instrumental for me for my professional development as a mentor, as a faculty, and now as a friend, as a roommate, as I call you, because for people that don't know, we share offices. So I feel it's a luxury to have you right there. You're part of my support system no matter what. So thank you so much for your support and for everything you have done for me.
Oh, thank you. And you know, it's mutual and it will never change. It only strengthens as the years go by. And I'm really, really happy to participate. And this is brilliant. This will have an impact. Hopefully everybody soon will get to hear and enjoy.
Absolutely. I hope so. Thank you so much.
My pleasure.